Hello, and welcome back to Error is Human, Why We Keep Screwing Things Up, and What to Do About It. I hope that those of you who are doing the homework enjoyed Thinking Fast and Slow. I think probably the most important lesson I took from that, because I did feel a little disappointed by the end of the book that there weren't clear lessons on this is how you fix this error. But I did take from that if you can identify those situations that are error prone and give yourself a cue so that when you go into that situation, you go in knowing that you need to use system 2. That's really the way to prevent error. And that involves some vigilance, but it also involves some planning in advance. And I think with that planning, we can identify those situations and make everyone safer. All right, so in part 5, we're going to discuss organizational behaviors that tend to foster error, increase the risk for error. And there are academics who have dedicated their entire careers to this, so I'm not going to do a comprehensive review, but at a minimum, I'm going to cover some of what are probably very familiar organizational behaviors you've seen and talk about why they put us at risk for error. Now, I'm going to start by dispelling a myth. Maybe you already know this, but lemmings do not commit suicide en masse. The Disney Corporation actually had to get lemming wranglers to drive them off of cliffs to simulate that behavior. So the suicidal lemmings are a nice theoretical thought, but they're also brainwashing. Sorry. So let's start by thinking about groupthink. And in groupthink, we often have to come together to make decisions as leaders and within organizations. And when we come together, we usually think about needing to manage disagreement. How is it that we can take many disparate views, people with different backgrounds, different experiences, bring them together, have them sit down, and work their way through disagreements so that we come up with, collectively, an agreement by the group on what we want to do. And that's typically what we think of as group facilitation, is how do we manage all those disagreements. But we need to be very careful that we also manage agreement, because there are incidents in which groups strive for harmony, and by striving for harmony, they fail to consider what the best options are. If you're creative and you're throwing out lots of ideas that will oppose what other people are thinking, or if a group is creative in throwing out those ideas, it's hard for the group to work together. And sometimes there can be fairly rigorous conflict. If there's an organizational culture that suggests that conflict is bad, that we all need to work in harmony and happiness, then we're going to fail to achieve those creative leaps that let us come up with the best ideas. And the other problem with this is that when we do that, we take away individual responsibility. No one person ends up being responsible for the decision that's being made. It's made collectively by the group, and everyone takes responsibility for it. Ultimately, that diffusion of responsibility means that no one feels responsible for speaking up and saying, this is the wrong choice. So how do we prevent this? Well, again, this is organizational level, so you need to be in a leadership position where you can foster these behaviors, but you need to encourage creative tension. You want someone in the room who is going to provide an opposing viewpoint. Now, here's the problem with that. Anyone who's ever worked in an organization realizes there's a hierarchy and a structure. And if you have a committee made up of frontline operators and senior managers, it's going to be very challenging for the frontline operators to criticize the senior managers. Now, with physicians, that's often not the case. And that's, I think, one of the things that comes out of the fact that this is a profession of doctorates, people with doctorates who are used to making life and death decisions. And that leads to a different type of tension that that often can scuttle a decision as well. But I'm talking more of if you've got an issue with room turnover. So your throughput times in your hospital are low because you can't get beds turned over, and you have a housekeeper and your vice president of patient care operations in the same room. It's going to be very hard in the structural hierarchy that you have to have the housekeeper disagree with the vice president. So one thing that you can do is to give people a way of anonymously criticizing the ideas that are put before the group. And there's two things that I need to say about that. By criticize, I don't mean, my gosh, that's the dumbest idea I've ever heard. By criticize, I mean critically analyze what's being put before the group. Well, I have concerns that this won't work because of X, Y, and Z. However, if we approached it this way, then I think that the combination of those two things would work. That is creative criticism. And it's not tearing people down without a solution. And anonymously doesn't mean that no one knows who you are. Anonymously means that only the group facilitator knows who submits the idea. So when people deviate from the accepted behavioral standards of the group, that is, you have to be polite, you have to be constructive in your criticism, the facilitator can go back to that person and say, well, this isn't what we're looking for, and can filter those types of critical analyses from what goes to the rest of the group. And this is very easy to do using all sorts of computer-based, internet, web-based systems. So that's an important tool for breaking down the power structures in your organization so that you get your best ideas put out together. And you need to make people responsible for their decisions. So there needs to be someone who is ultimately responsible for making the decision in any group, and doesn't have to be the group facilitator, but it has to be the person who has both the authority to make that decision and the level of responsibility to accept the consequences of that decision. Now, one of the other big areas is this concept of drift. So an organization starts out with something, with a mission in mind, patient care, but we start to drift from that mission and we get into other areas, and we kind of diffuse our focus, and ultimately we make some decisions where we're really not supporting our core mission. And in fact, our course has gone far adrift from our core mission. And that may or may not be harmful, but it's certainly an error because we're not serving our mission. Now, one particularly insidious and dangerous form of this is called normalizing risk. And this happens generally in high-performance organizations that have figured out how to minimize risk in their business activities, whether it's healthcare or flying airplanes or making vacuum cleaners. We know there are areas of risk for failure, and that can be risk of harm, that can be risk of producing a poor product that puts you out of business, organizational risk. So we make decisions over time that individually make sense. So let's start with a high-performance hospital that demands a 3-to-1 nurse-to-patient ratio on the floor. And with that, the nurses are able to put a tremendous amount of time into the bedside care of patients. But someone says, okay, we could probably do this with a 4-to-1 ratio or a 5-to-1 ratio if we added a nursing tech who can do some things that nurses don't need to be doing, who can go in and get vital signs, who can get a patient a cup of water, who can help them sit up in bed, who can walk with them to the bathroom. That's actually probably perfectly acceptable, and we do that all the time in medicine. We want to be efficient. We want people to work to the top of their licenses. But then we say, all right, you know what? We should really look at the license of these nursing techs, and can they distribute medications, the oral medications? Sure. The nurses can review them at the desk, and then that way the nurse can do all 5 of his patients' medications, have them laid out, and the nursing techs can just go and they can give them the medications, and that makes the nurse more efficient. So we need less expensive nurses, and we have more less expensive nursing techs, and that works out. And we say, you know what? We can train the nursing techs to run the IV pumps. I mean, it's not that hard a thing, and we can make that happen. And so what we've gone from is a nursing tech who's trained to get vital signs and assist patients and to essentially be a patient advocate to someone who's now doing nursing skills. And each of those decisions incrementally makes sense. And then at some point, there's a bad outcome. A nursing tech who isn't trained in their original education, who doesn't have the depth of understanding of pharmacology, who doesn't have the depth of understanding of using the equipment, ends up pushing a medication that was inappropriate, and there's harm. And we go and we look at this and we say, gosh, we never would have thought that something like that could happen because we were dedicated to having high quality, high intensity nursing care. How did we get here? Well, that's normalizing risk. Each of those behaviors, each of those decisions were a form of risk. We were putting more responsibility on someone for whom doing that task was closer and closer to the edge of their experience and training and capabilities. So we see that all the time in medicine and in other industries. All right, so I want you to go online and I want you to search for the Abilene Paradox by Jerry Harvey. This is a sort of classic paper on how groupthink works, written in the 70s. So I want you to read that. It's a great read. And then I want you to think about your own life and a couple of episodes, preferably one personal and one professional, when you did what the characters in the Abilene Paradox did. And think about how, when those events happened, you could have done something differently. Not something rude or disruptive, necessarily, but just asked different questions or thought about something in a different way so that that would not have happened. All right, well, thanks for your time, and I look forward to seeing you in the next session.